Hello, my name is Steve Long and I'm the CEO at Hancock Health and Hancock Regional Hospital. Coming to you today to talk about the COVID-19 virus and the preparations that we have been making at Hancock Health and the things that are happening within our community and frankly within our state and our nation as well, because you know that we have mobilized everyone across the country and frankly across the world to deal with this crisis. So I will tell you that the big thing for us is that there is a very real concern that our healthcare system could be overwhelmed by the people that have this disease. And by way of background, we know that most of the people that get the disease are not going to be affected very, very highly by it. In fact, they'll have very mild symptoms. And that's going to be about 80% of the people. And for those folks, many will not even know they had the disease. Others will think they just had a bad cold or maybe the flu. And so we're not worried about them because they're likely not going to impact healthcare except for maybe calling their physician, showing up in the physician office. The bigger issue is the 14 to 15% of people that will get so sick that they need to be hospitalized because they need oxygen. And then there's another 5% of the people that will be really severely sick and they're going to need ICU level care, likely on a ventilator or a breathing machine. And then of course 1 to 2% are likely to die based on current statistics. It is that 14 to 19% of people that we're really concerned about, because if all of those people got sick at the same time, even though it's a small percentage of the population, it could really overwhelm the capacity that we have in the healthcare system. So let me give you a few facts and figures about Hancock Health. So we are not a huge organization, but we're not tiny either. We're about 100 beds, and the majority of the work that we do is actually outpatient. 70% of all the services we provide are in the outpatient setting. Let me give you a comparison. So in our inpatient wards, we admit about 4,000 to 5,000 patients a year. But we see 24,000 patients in our emergency rooms, and we see about 190,000 in our physician clinics, and we see about another 190,000 in our outpatient departments. So we're really geared to providing outpatient care. That doesn't even count all the people that show up in our wellness centers. So as we look at something like this, the number one thing on our mind is we have to create capacity for people that will end up inside the hospital as an inpatient. So we've done a number of things. So number one, because we know this is a contagious disease, we have limited the ability for people to gather in any of our buildings. So we closed our wellness centers effective a few days ago. So those are closed now to everyone. We have changed the intake process for our physician clinics so that you now have to call and you're screened to see whether you have some of the symptoms of this virus, so that if you do, you can be turned in a different direction and be evaluated for whether you might have it or not. And on the hospital side, we have actively closed many of our units. So we have a geropsychiatric unit, and we have closed that unit. We have really worked hard to limit our elective surgeries so that we don't have as many people being admitted for things that they could do later. So we have created capacity inside of our building. We've taken all of our non-essential folks, and some of those we have sent home so they can do their work at home and not be impacted by this, and the rest we have actually put into disaster teams. So every single person that comes into our building now is screened for the symptoms of this virus. So we have people that staff that. We've created a new hotline that you can call in. It is 317-325-COVID, COVID. I think it's 2683. In addition to that, we've created our triage clinic. So that required personnel that would otherwise be used. We have taken all the folks that we've redeployed from other departments into those functions. So we have really lowered the amount of activity that's happening in preparation for the droves of people that may come in. Now, I will tell you, we are very hopeful that that does not happen. We are hopeful that the activity that is taking place in our community, so you may know there's a travel advisory now. You may also know that the governor has issued the order for restaurants and bars and nightclubs to be closed so that people do not congregate. You may know that the number of people that can congregate together has been limited to 50, and in some cases to 10. So there are churches that are not meeting and sporting events that are not happening. So all of this is so that we do not transfer the virus around. We are very hopeful that all of those efforts have an impact and that it can mitigate the number of people that will need to use our services. Now, I'll tell you, we're still a few weeks away from knowing whether that's going to work or not. So please know, we've done a lot to prepare for what might happen in the hope that it doesn't actually happen and that we can get back to normal. But it's going to take 6 to 8 to maybe 10 or 12 weeks for this really to roll through. And so we ask for your patience. And we are very happy that we have partners in our local government, in the business community, and in the schools, and in the churches. And together, we're going to work and we're going to make this thing as good as it could possibly be. But please know, we have prepared ourselves for any eventuality, and we are here to take care of you. So if you need our care now for any reason, please access us. We're here to take care of you. Thanks very much for watching this video. More updates are coming.